Well, good morning, everyone, and thank you all for joining us today for Kentucky Spin's webinar. We have a wonderful professional panel that will be joining us today. I'm so excited about hearing from each of them. We here at Kentucky Spin really wanted to try to get some information out to folks. The great thing about what we do is we will be live sharing this webinar, but it will also be recorded and we will have it on our website for folks that maybe weren't able to be on today to still be able to get the information. So we're really excited about who our guests are today. I'm just briefly going to mention their names and then I will tell a little bit more about them when we get to their presentation. But we have Shasta Hensley with us, who's with Kentucky Department of Education. We have Donald Ray, who is having a little technical difficulty right now. He is with Mountain Comprehensive Care. And then we have Davina Bales, and she works with the Office for Children with Special Health Care Needs. So we're very excited about the presentation, and we hope that you all gain some great knowledge today, hearing from some other professionals around the state. I'm Stella Beard. I'm the Assistant Director for Kentucky Spin. I also have Kelly Smith on the line and Michaela Evans, who will be helping us today with our questions and just helping us navigate through the webinar today. I want to tell you a little bit about Kentucky Spin. Kentucky Spin is the Kentucky Special Parent Involvement Network. We are the Parent Training and Information Center for the state of Kentucky, or the PTI. We're funded through the U.S. Department of Education under the Individuals with Disabilities Education Act. And we have actually been the Parent Training and Information Center for Kentucky since 1988. And that was when the first PTI grant was initiated, and we have been able to provide that training, information, and support for children and youth with all types of disabilities since 1988. And I'm happy to say that we just recently received notification that we have received funding again for another 5 years. So we're very excited that we get to continue to work with families, parents, and professionals and help them navigate the special education process. Something we do not do is we do not act as attorneys. However, we empower families to effectively advocate for their children, and we provide peer support to help families access needed information and resources. And what that means is, with that peer support, is all of our consultants and staff are either parents of a child or a young adult with an intellectual or developmental disability, or we are a sibling, or we actually have a disability ourselves. So I have a 24-year-old son with an intellectual disability. So I have navigated the special education process in the school system for many, many years. I've actually worked in the school system, and now I believe I have the best job in the world working with Kentucky Spin and getting to help families on a daily basis and just be there for them and provide that assistance and do things like we're doing today, is provide resources during a pandemic and still able to get that information out to families and professionals as best as possible. This is a slide that we show on all of our webinars, and it just says, together we can accomplish great things for our children. None of us have all the answers, and we are all working through this pandemic and adjusting as we go. And I am very happy to say that we have done that. Since March, we hit the ground running, boots on the ground, doing whatever we could to provide that information still for families when we were no longer to meet face-to-face. We jumped in and were able to start webinars immediately in March. And we have been consistent on that every Tuesday and Thursday since March, pretty much every Tuesday and Thursday, to provide resources and information for families on a different scale. And that was through, a webinar means. And so we're excited to say we have been able to still provide that assistance with so many people through all of this. And I think that has been something that we are very proud of and excited about. We do have webinars still scheduled through December, and we're planning our now January, February schedule. And so you can find out more of our webinars that are available on our website, and that I'll be giving you that later on. But just to navigate a little bit for you, on the right-hand side of your screen, you will see a dashboard. On that dashboard, it has some features that you're going to need to be aware of. One is a little drop-down box that has an arrow and it says questions. If you click that little arrow, it'll drop down and show you a place that you can type a question in, and you can send it privately to one of the speakers or to myself, or you can send it to everyone. And then we're going to monitor those questions throughout the presentation and hopefully be able to answer them for you. And if not, we will get back with you individually. Also on the dashboard, you'll see a little drop-down box that says handouts. If you click on that, it'll show you two different handouts that are available today. One is the PowerPoint that you're seeing on your screen now, and the other is a directory of services and providers that Davina has provided for us, and she'll talk about that when it's her turn to do her presentation. So you can download those now if you want to, or later this afternoon, I will be sending a follow-up email, and those handouts will be included in a follow-up email with a certificate of attendance for attending today. So I think that is it as far as all of the little housekeeping things. So remember, if you want to type a question in, please feel free to do that, and then download the handouts if you choose. So we have three wonderful presenters with us today. One is Donald Ray. He is a counselor at Mountain Comprehensive Care. It looks like he still might be having, it looks like he might have his sound working now. So that is great. We'll test that in just a second. And then we have Davina Bales, who is with the Office for Children with Special Health Care Needs. And we have Shasta Hensley, who is with the Kentucky Department of Education. So I believe right now we have Donald, who is going to go first. So Donald, can you unmute for a second and let me know you can hear us? Can you hear us, Donald?
Yeah, I unmuted.
Yay! Wonderful. I can hear you. So that's great. If you want to show your camera real quick so everyone can see your smiling face. Or maybe you are showing it.
I thought I was.
Okay, great. I had to minimize it because I couldn't see the screen. So all is good. I think everyone can see you. So I'm going to turn it over to you, Donald, and let you tell us a little bit about the services that you provide at Mountain Comprehensive Care.
Well, I'm the local resource coordinator with the Big Sandy REAC. We do everything that is involved with that REAC. We write grants. We do community outreach. We do a lot of different things. The main thing is the community partnerships that we have with each other to provide services for our 5-county region, which is Pike County, Floyd, Johnson, Martin, and Magoffin counties.
Great. Now, when I need to go to the next slide, Donald, you just tell me, okay?
That's fine.
Can you tell us what REACT means?
It's Regional Interagency Committee.
Wonderful. It doesn't look like, I don't think they're seeing your camera or your video. Let me see if I can fix that. There is always little technical difficulties.
How about that?
There we go. There you are. Awesome. Okay. So let's see. Let me see if there's, do I need to go on to the next screen?
No, let me talk about this one real quick.
Wonderful.
This is our logo for our REAC. The three banners below that, actually they were billboards. We wrote a grant, a COVID grant, and we put one of these in each county that we have, 5 counties. The kids in the group homes and our kids that are in our services voted on which one they wanted in their county. So these are the two that we had to choose from.
That's great. So you all applied for this grant and were able to provide all of this in your area. That's wonderful.
Yes. So can you go to the next one?
Yeah, it's a little slow, so hang on. There we go.
There we go. These are just some numbers of our agency and the clinics that we have across the state, the counties that we serve, and the number of clients that we serve annually is 32,000. I think those are extremely high numbers for a little bitty community mental health in Eastern Kentucky. But those are all a part of a great staff that we have across the state, not just in the 5 counties that we represent here.
That's great. That is a lot of clients. Now, can you tell everyone, are there more comp cares around the state of Kentucky?
Yeah, they're all through the state, and each community mental health will represent a REAC. There's a REAC in every one of the community mental health.
I'm switching the slides. I'll give it just one little second.
Take your time, okay?
There we go.
And of course, the counties in the green are where we are, where we have clinics and offices that we provide services. So that's a large portion of the state that we cover, and of course we couldn't do it without the great leadership we have and the great staff that we have through this pandemic. It's been tough on everybody, and I think if you have a job right now, you should be really grateful.
I think Stella may be having some technical difficulties. So thank you, Donald. I appreciate everything that you've told us and everything that you do. And I can't wait to ask you some questions in just a few minutes. But I'd like to go ahead and introduce panel member number 2, which is Shasta Hensley. So Shasta, you go ahead whenever you're ready.
And I'm back now.
Yeah,
sorry
thank
about
you
that,
so much.
guys.
Yay.
So sorry, Shasta.
I'm telling
I am so
you,
sorry.
No, look, these the gremlins of internet and Zoom calls have been very active today. I think they're getting paid overtime because
I think
my
so.
earlier meeting this morning, it was just the same kind of thing. It was crazy.
And thank you, Kelly, for catching that and moving right along.
And before we begin, I do want to apologize. I just, like many people, I don't have great internet. I live in a place that has only satellite as an option, which means that whatever I say or whatever you see on the screen, it goes from me to up around the moon, and then it comes back down. So there's this delay. So if it sounds like I'm interrupting or there's this weird stall, it's my internet, and I apologize.
Well,
But thank you all so much for having me on today.
I was just
I'm
going to
sorry.
say,
Go ahead,
no
Donald.
need to apologize, because with all the virtual learning that's going on with all the kids in schools, and then all the people that's working from home, we're just lucky to be able to get on the internet. So there's a lot of movement, a lot of action going on with the internet. But I didn't mean to interrupt. I just wanted to say that we have it here all the time, and I am the worst computer IT guy in the world. So I apologize for my to start with there. So
That's okay. We're glad you made it.
Yeah, we're here, right? That's the important thing. We'll just blame everything else on the internet. It's fine. So yes, thank you all so much for having me on. I appreciate the opportunity to just be on the same panel as your other guests, but then also just be able to share information about some of the things that are happening and going on. And like Stella and Kelly have already said, I work for the Kentucky Department of Education. I work in the Office of Special Education and Early Learning. So if you hear me say OSEAL, I'm not talking about like a little animal. I'm talking about that's what we call ourselves as OSEAL, the Office of Special Education and Early Learning. Go ahead, next slide. And I thought it would be important to introduce myself a little bit. I know sometimes when I'm on, webinars or Zoom calls, I'm like, who is this person and what gives them any right to talk to me? So I thought I'd give you a little bit of just kind of information about myself. I am an exceptional child consultant with the Kentucky Department of Education. I do lots of things there, but my two primary roles are parent and family engagement and English learners with disabilities. Those are like my big buckets. This is my 16th year in public education in some form or another. And I'm also a mom of 2 humans and 4 fur babies. And don't tell my cats, but they didn't make the slide. But you can see my son and my daughter, and then my 2 dogs as well. But I also have 2 cats, but they just didn't make the screen. And then my husband as well. And I just kind of wanted to break down the Office of Special Education a little bit. We have 3 divisions that do the work. We have the Division of IDA Implementation and Preschool, which is where I live, over in Dip. That's so fun. And we do a lot of things with like guidance and support, preschool, those sorts of things kind of sit over in our division. We also have the Division of Monitoring and Results. And they will work with, we all work with districts and we all work with families, but they do a lot of things around like the monitoring piece and, working with districts around that. We also have the Division of State Schools, which is the Kentucky School for the Blind and the Kentucky School for the Deaf. And those are in our state. That's all, I don't want to give you a whole lot of information, but yeah, we have those 2 schools as well. Go ahead, next slide. And then how does OSIL support family school partnerships? And I just thought, well, there's kind of 4 different ways that we do that. The first, or not the first, but one way that we do this through districts and school partnerships. And so we work with districts, we work with schools, and that could be administrators, teachers, principals, counselors. We work with those who work in the district and school system to know how to support parents and families. You see, how can we support parents and families? We listen to what they're saying and what their needs might be. We also work with community and agency partners like Kentucky SPIN. We work with the Kentucky Autism Training Center and the Advisory Council for Autism, our regional special education cooperatives, our early childhood training centers, all of those things. We work with those agency partners and community partners to also kind of see how we can support parents and families. Ultimately, it's always about students. Our goal is to always support students with disabilities. But we know that supporting teachers and districts and supporting families is critical in that work. And we use this to kind of think about what our students and our families and our districts need. We also work interagency, so we may work with other offices. There's lots of offices and divisions at the department, and so we may work with, say, Title III, or we may work with the Office of Assessment, or we may work with, one of the other division directors to kind of know how we can work together to best meet the needs of students and their families. And of course, we work directly with parents and families. And so whether that be through a phone call or an email, providing guidance, providing resources that we think that parents and families may need, we take the input of parents and families as something that's very valuable. And so we'll kind of, listen into what our parents and families are saying and say, okay, what do we need? What can we do to support that? Next slide. And just a couple of new tools and resources that we have out. We had kind of revamped our web pages, and there are some new things that are out specifically for parents and families. The Parent and Family Resources webpage has several things on it that are maybe of interest to parents and families. And one of those is the Parent and Family Toolbox. And so it just has lots of like resources. If you're a family member and you want to know more about virtual instruction, maybe you want to know more about transition for your student. Maybe you want to know more about specially designed instruction. So there's different resources in that toolbox. There's also like you want to be more involved. You want to know what sorts of agencies and community partners you might work with to use your voice. Then there's some resources for that as well. We've also put out a Q&A for parents of children with disabilities. It's specifically speaking to some of the school like reopening and things, reopening guides that goes with our flagship document, but it talks about some of those specific things. Some of those questions that we got from parents and families to help answer those questions. There's also a parent and family rights page that kind of talks about parents and families' rights as families of children with disabilities. And how we kind of designed those pages was we looked at what our most common questions were from parents and families, and we put them into like a question, answer, and set of resources to go with it. So even if you're just like, I kind of understand this ARC business, but I would like to know more, there's a question that says, what is the ARC? What is the Admissions and Release Committee? And so it breaks that down and also provides additional resources, many of which are from Kentucky SPIN. So we're so thankful for their support. And just other things that may be of interest to kind of help you grow your knowledge on that and just help you just be an even, better partner, in that ARC team. So that's kind of how that was designed. And as always, if you ever have questions or, need a resource that you're just not seeing there, you're welcome to email me. And we will get that information to you as best we can.
And
Next
Shasta,
slide.
all of these, the little resources that you've listed here, they're all clickable links. So when everyone gets the PowerPoint, if they don't download it during the presentation, if they just wait for the email, they'll be able to click this and go right to all of those resources.
Yes, ma'am.
That's great. I love that when there are clickable links. I don't have to go Google anything.
And this is my information. So if you ever want to contact me directly, you can give me a call, and that's my extension. However, the best way probably to reach me, just because of the I also have terrible cell service. That's awesome. But the best way to reach me is through that email. And you can email me a question. You can say, where could I find this? Or I just would like to talk to somebody about this piece. You can email me, and then I will find a good spot in my house with good cell service, which is usually right over my kitchen sink. And I will give you a call back, or I'll give you a call so that we can discuss that if you need to, or we can just discuss it through email, either way that you prefer.
Well, that's great, Shasta. I'm right with you there on the service. I live in the country too, and it's a little frustrating at times. Donald said I think I'm just grateful that I have service right now. I'm going to let Kelly introduce our panel member 3, because she has a very she has a connection with her.
Okay, so next up is Davina Bales, who is my sister. She's the nurse administrator at the Office for Children with Special Health Care Needs. So Davina, go ahead.
All right, thank you. Thank you all for having me today. First of all, I always tell everybody this when I'm on a webinar: please excuse the way that I am looking at the camera, because the camera is on. I've worked for the state, so we have very outdated equipment, first of all. And so my camera is way over here, and I'm reading stuff on here, and so I'm never looking at the camera, and it drives me insane. So I'd just like to throw that out there if anybody cares. But I'm so happy to be here. So many people don't know about the Office for Children with Special Healthcare Needs. We used to be called the Commission for Children with Special Healthcare Needs. So a lot of people just refer to us as the Commission. We provide comprehensive care to children and youth with special health care needs who are the Kentucky residents. We see children from age birth to 21, and they have to meet medical eligibility and financial eligibility. And I'll elaborate a little bit on that. The medical eligibility, we only offer certain clinics. And so there are only certain diagnoses that are considered medically eligible to be in our program. So a child may come in for an autism evaluation, but not get a diagnosis of autism. However, they may have ADHD. Well, ADHD is not a medically eligible diagnosis, so we could not follow that child. So it just depends on what the diagnosis is. Financial eligibility, we take every insurance, Medicaid and every private insurance, all the MCOs. And then we have a family participation fee, which is kind of like a sliding scale thing based on income. If they have Medicaid, obviously there's no copay. If they have private insurance, then we look at family income, and a copay could be $5 or it could be $15. $15 is the max, so that's always great. One of the things that I like to tell people about the financial aspect is so many things that we do in clinic, we do right here on grounds in clinic. So you may pay a $15 copay, but your child will see the cardiologist, have an EKG and their echo all on the same day, and all under that $15 copay. So it's super helpful for families who have private insurance and who would otherwise have to pay copays for all those things. It's really nice. Okay, next slide, Stella.
It's just a little delayed, so hang on one second. There we go.
That's fine. So our mission is to enhance the quality of life for Kentucky's children with special health care needs through quality service, leadership, advocacy, education, and collaboration. When we first started the commission almost 100 years ago, it was for kids who lived in rural areas that could not travel to, if you lived in, say you lived in Hazard and your doctor was in Lexington. So that's why it started out, so that we could offer kids specialty services all over the state. That continues to be the case. And we also advocate, we help. I know I go to IEPs for kids sometimes, and we do a lot of care coordination where we hook these families up with the resources that they need. So it's not just a medical clinic, they come in and see the doctor and then they're gone. There's a lot more services that we offer than just that. Okay, next slide. And we have a variety of clinics, and the one thing that is helpful to know is that not every clinic, which, let me back up, there's 11 clinics in the state. Not every clinic offers the same services. So like my clinic in Somerset has autism diagnostic clinic as well as autism medical clinic. For about the past 5 years or so, we've been the only clinic that offered autism diagnostic services, but Moorhead is actually doing that now as well. So Somerset and Moorhead. And then we have some clinics have eye clinic or otology clinic. Somerset offers the autism, audiology, and we have a hearing aid program. cardiology, orthopedic, and neurology. So those are the services that we provide in Somerset. Okay, go ahead. And of course, we're under the Cabinet for Health and Family Services. Our main office is in Louisville, and this is our contact information. And my contact information is, I don't know if it's included. I may not have included it, but I can definitely put that on the screen. If there's any questions, I'd be happy to go over anything.
Awesome. That's great. Thank you so much for all that wonderful information. And I'm going to do just a few questions for you all, if that's okay. And we've got some questions that have been sent to us too. So I'm just going to ask a question, and then you all can just kind of jump in, whoever wants to answer first or whatever. But kind of share your why, and why did you get in the field you were in, and what keeps you there?
I can start. I've been a nurse since 1993. So I've been in a lot of different fields of nursing. And I came here, I've been here for a little over 8 years, I guess going on 9 years now. And I just have always wanted to work with children, and I never had the opportunity to do that. The 10 years prior to me coming here, I worked at Oakwood in Somerset, which is a facility, a residential facility for individuals with intellectual disabilities. And I feel like that kind of paved my way here. I have a child with autism. I have 3 children. One of my, and a set of twins. One of the twins has autism. So I've actually helped pilot the autism program with the Office for Children with Special Healthcare Needs, which I'm so proud of. They did not offer that service. I'm not saying that I was the reason that they started it, but I definitely advocated for it for several years before we piloted it, and it's been so successful. And so that's kind of why I got into the field, into this field in particular. I feel like everything I've done in my career up to this point has prepared me for this job. And I love helping families and helping them navigate the healthcare system and then everything else that comes into play with having a child with special healthcare needs.
I love that. Thank you so much. Shasta, what about you? What's your why, and what keeps you doing what you do every single day? Shasta, can you hear me? I think she's on mute right now.
Yeah.
Donald, what about you? What's your why?
I was talking away. Could you?
Oh. I think that's the
Yep,
story
just
of our
talking away.
life,
It was
isn't
great.
it?
Yes. But no, I'd say so much of what Davina said. I feel like I could echo. Like, it was that, I've been in this for 16 years. I've been at the department for 2, and all of the things that have led me to this place. It's like a really cool thing, but I'm not gonna take up all of our time. But I love the work that I do. I love working with and supporting, families and parents, working with districts to support families and parents. As a parent of a child with disability myself, I know the importance and the value of parents and families. And I know how important it is that parents and families have the tools and the resources, that they need to support their child. And so I love doing that. I love building tools and giving resources and giving parents and families just access to information. And then I think that's the thing that just kind of keeps me here is like I think of all the things that, you know, I'm like, oh, we should do this, and oh my gosh, we could do this. And I hear from our partners and, you know, and from parents, oh, that's such a good idea, let's keep doing this. And it doesn't feel like work. And I know that sounds like super cheesy, but when it comes to this piece of my job, it really doesn't feel like work. I really enjoy it. And so I guess that's the what keeps me here.
So Shasta, you're great at what you do, and we're so happy that Kentucky Spin is able to partner with you and keep that communication open. I think it's a wonderful partnership. Donald, what about you? What is your why, and what keeps you doing what you do?
Well, I have a mortgage and a couple of car payments and 2 kids in college. Aside from that,
Okay, I love it.
aside from that, we have a summer camp every year with the kids that are in our services. We continue the services through the dead period of where school's not in session. We feed those kids and we take them for some activities like swimming and movies and things that some of them have never gotten to do. So I tell people all the time that I was one of those kids. So and that's it. That's it in a nutshell. I know what it's like.
I love that, Donald. And you know what? I think that's a lot of us have either been there and see the need ourselves, or like Shasta was saying, you know, we're parents or we've been there ourselves. So I think that's wonderful that, you know, we're all in this for a reason. And I think it's important that people know that, yes, I need to pay my bills too, but I also have a passion and a desire to help families. And that's pretty much why we're all here for sure. Well, I have a couple of specific questions here I'm going to ask you. Let me see. Let me go back and grab those really quick. Okay, hang on. I scrolled back too far. Okay, for Donald, what types of services does Mountain Comp Care offer for individuals with disabilities, and how can someone apply for them?
Well, we have school-based services, school-based therapy that right now is, I think of course, I know they're doing everything virtually. I don't know how well it's going. And we have a lot of case management services. We actually wrote a grant that provides, we had we got a need for in-home services, a lot of other things that go along with that. But I think the first thing is just where they have to be identified. They have to come in and do an intake and somehow do an intake over the phone or whatever. But that's the first step that they have to do.
And Donald, it's the same process no matter what county you live in. If they live in the counties you represent, they would go through you. But if, say, I live in Fayette County, I'm going to go through the comp care that's there in that region. But it's the same process, correct?
Same process. Yeah, we all do the same thing. And as far as getting them in services, but yeah, it's all the same 3 or 4 steps that they have to do.
And we know right now, you know, everything looks totally different and it changes every day. And I know that's hard for, you know, families, but it's also hard for the folks that provide the services too, because it is changing quite frequently. So Shasta, this one's for you. What types of topics do parents frequently contact you about?
So usually there's like a common thread of just like there's like a miscommunication, or they just need some information. You know, I think that's like the common thing, right? And so they may be about different things, like about a specific disability or a specific service. But oftentimes it's what's the law here, or where are some resources on this? How do I learn more about this? How can I communicate, with my child's school or with the district. And so those are the things that we get, most commonly. And like I said, we tried to address those as much as we could, through the web page and through the resources that we've provided. But if a parent ever feels, or a family member feels that they get on there and it's just not hitting the mark, they're still got some questions. Again, we always encourage that communication either with us, or with the school, the teacher, the director of special education are always so knowledgeable and helpful. And so we always encourage, don't hesitate ever, 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 ever. Don't hesitate to ask a question. There's no bad question, and there's so much to know. So always, go look for the resource, and if you don't see it, ask somebody.
And I love your all's new page, Shasta. I think that is wonderful. I especially love the frequently asked questions page. I think that's really good for families. We need to be sure that we, get the word out about the revamping, of your all's webpage too, and we can help do that. Because I think that's really good for parents to have, as much information as they can possibly get, and that way they can access it when they need it. So this next question,
Absolutely.
Go ahead, Donald. I'm sorry.
That's all right. I just wanted to add to that. As the LRC, my job and the REAC's job is to link people up with services, families up with services. We don't really care who provides the service as long as they get the services that they need. And a lot of times we get families that don't have clothes or shoes, or can't pay their utility bills. And we put a resource directory together for our 5 counties, and it was on paper. It's kind of obsolete now. That was about 5 years ago. We're trying to put all that on the website, so they can just, like you were saying earlier, you click and you get what you need, contact who you need. So that's another thing that our REAC does. Well, every REAC should be doing, but that's one that we are trying our best to get done by the spring.
I think that's awesome. I know one of the frustrating things for myself when my son was diagnosed, he's 24 now, but when he was just finding those resources and somewhere to go. And it seemed like, I would call one place and then they would tell me to call someone else and then call someone else. And that is frustrating for a parent. So I think that's wonderful that that the REACs would do that and have that information out there for families so they can just click and go to the place that they need to in their region, in their area.
Yeah.
Okay, well, this question is for Davina, and it says, can the commission do diagnostic evaluations for mental health or intellectual developmental disabilities other than autism?
No, we cannot. I wish that we could. I will say that our autism diagnostic clinic does diagnose more than just autism, but the child has to be referred for autism. There has to be a concern for autism, but we do give the parents guidance and diagnoses, even if we don't see autism, which I think is really nice, because a lot of places when you go in for an autism evaluation, it's a yes or no answer. Yes, your child meets criteria, or no, your child doesn't meet criteria. And for those agencies or facilities or professionals that evaluate and just say no, the family basically kind of has to start over at that point. And that's one of the things I really love about our clinic, is that even if you don't get a diagnosis of autism, if our doctors see something else, they will give you that information and give you resources so that you can go forward at that time to try to find resources for what your child needs.
That's
I'm
great.
hoping that
And do,
I
do
am
they
hoping
have to have a referral for services, or can a parent just kind of call?
that for everything besides an autism um, appointment, they can refer themselves. They can self-refer. But for autism, because there's so many kids on the waiting list, and because we can only see 4 kids in every clinic, um, because the evaluation process is longer than just a normal clinic appointment, doctor's appointment. We do require a referral for autism evaluations. And we also have an autism medical clinic for children who already have a diagnosis of autism, and that's basically just to let your child see a specialist. I know, being a mother of a child with autism, it's just wonderful when you can go into a doctor's office and you not have to explain to them what your child's needs are. It's huge. So that also does require a referral. That clinic also requires a referral, but for the other clinics, they do not require physician's referral.
Okay, that's great information. Thank you. Shasta, this is for you. You mentioned Title III. What is that?
Yeah. So, the within the federal government, there's lots of title programs. Title III is specifically for like English learners, things like that. And as I work with English learners with disabilities, I work with that office or that group, pretty frequently. And so that's what Title III is. In ways, like there's like Title I and Title V, and there's all the titles that that the federal government has kind of designated as like a program. And I am not the expert on that, so I probably just said it wrong. Please, if I said it wrong, I apologize. But Title III is like for English learners and things like that.
Great, thank you. It's funny because, those are things that, especially in the world of special education, there's so many acronyms, and a lot of times we use them all the time and we don't think about it. And, now, and then there's all the different titles with numbers that you don't think about, and a lot of folks don't really understand what all that means. So that was a great question. And so, Donald, this one's for you. Do you know if other community mental health centers provide camps and such like you were talking about?
I'm not sure if they do the same thing we do. I know that a lot of people have joined us over the past few years and to try to pilot one in their area. So I think they're doing similar kind of work, but just a different version, maybe one that suits their agency better. We go out, we get a lot of donations that help pay for this, and we got a great support system that funds a great deal of the bill. And but I don't know if they do or not, to what degree they are doing it.
Well, that's something folks could look into in their area just to see, because I think that's a great thing you all are doing there for sure. Davina, this one is for you. We have time for a couple of more. How does the Office for Children with Special Health Care Needs provide advocacy for children and young adults?
We are able to go to IEPs. We participate in a lot of interagency committees and try to, of course, before this COVID, we were always very active in the community. So I think it kind of depends on which area of the state you're in and what all services are offered there. But I know for me, I do participate in a lot of IEPs and give families that information. Just go for moral support, if nothing else. I mean, and it seems to always make a positive difference for kids at the schools when the parents go in there and they have somebody just sitting beside them. And I know that a lot of in the other clinics, the social workers will go. I feel like I go here more than anybody, usually just because of the autism diagnosis factor. I would be happy to go with anybody, but it seems like I do go with those kids the most. Also, we have we've helped the school nurses. We can help with there's a new medication. We can help provide information for that if they're administering medications to the child at school. So I think we're available to do about anything anybody would want us to do if they just ask. We're here to help.
I think that's great information because, you know, we get asked a lot at Kentucky Spin to attend IEP meetings with families. And of course, we do not. That's not part of what we do. We just provide, you know, the resources and support. But that's great to know that you all are doing that. I think it's a wonderful service. That you're exactly right. Sometimes families just need that someone there with them, especially when their child is younger and they're really not sure what to expect. So that's great. That's wonderful.
Right. And I know that, you know, protection and advocacy will attend as well. But I feel like that we're not viewed as, I don't want to say threatening. That's not really the right word, but we're there more as just an advocate for the family. So, and I think that comes across well. And a lot of
Yes.
times kids, you know, the kids have 504 plans for medical issues, and it's helpful for a nurse or the social worker who knows that child to go in and give the whole team more information about that child's disease or plan of care.
That's a great way to put it, you know, and I like the what you said about just being there, you know, just to help and even just to take notes or something just so the family can listen. I think that's a real important piece too. Well, Shasta, I have a question for you, and this is what do you have I mean, I guess the way to frame it is, you know, is there something critical that you feel families need to know right now in the middle of, you know, we just got word yesterday that schools will be virtual, you know, for the remainder of the year, most of them. And is there anything critical that you think families need to know right now?
Yeah. So I would say probably the most critical thing is don't hesitate to communicate. And what I mean is if something, you know, is working, you know, something is going well, communicate that with your teacher, your child's teacher and your child's school, because in the same way that this is really hard for families and look, I completely understand how hard this is, you know, having, you know, kiddo at home and also trying to work and do the things. It's really hard. So if you see something going really well, share that, you know, and also if something isn't working, you know, communicate that with the teacher or the ARC chair or the counselor, whoever even if you just like you have a good connection with at the school, would just be to communicate that, like, you know, my kiddo, like we're trying really hard to do this Zoom breakout room or you know, whatever it might be. And he is just really struggling to be independent in that, or he's really struggling to maintain attention in that, or we just can't access it. You know, communicate that and work to just kind of problem solve that and see what solutions there might be. Um, and then just, you know, don't give up. This is hard. And I just want every parent and every, you know, teacher or you know, support. And we've got some advocacy people here. Um, you're not failing. This is just really hard. You know, don't give up. Don't lose hope. It will get better. You know, just keep being graceful and kind to each other and keep communicating. And again, like I said earlier, there's no bad question, there's no wrong question. It's okay if you don't know something because this is literally new to everyone. So just communicate your needs, your concerns, but as well, you know, what is working, because we all need that little bit of hope too.
I think that's the best advice. I think I love the fact that, you know, you communicate what's working and then also share what's not working. That's really important, because I think families are just, struggling, and not only the families but the kids. I think the kids are struggling too, and they really aren't quite sure, how to handle it all. We try to be real positive here in our house. I have a son that's a senior, and who doesn't have a disability, but he needs that, he really needs that in classroom instruction, and so it has been difficult. And so we do try to focus on the positive as much as we can, but that communication is key for sure. Well, do any of you all have any final thoughts you want to share that's just burning, that you want to be sure that gets out there before we wrap up?
I just want to add to what Shasta just said about, I think it's important for our families and kids to know that we are struggling right along with them. We have kids that are on laptops that don't get internet. It's shady at best when they do. Families, parents that have no idea how to work a computer or laptop. There's a lot of barriers that we're facing, and these kids are facing right now, just to try to get assignments done. And my wife and I had COVID in March in the hospital and the ICU at the same time. So we pulled through, and that's the thing that we keep telling kids. You can make it, but you got to be a fighter. You got to be willing to get out of bed and get the stuff done. And if you need help, you can call us. I coach football. There's a lot of ways that we can resolve that problem with the computers. So we're always helping kids somehow.
That's awesome, Donald. And I think it's great to know that there's so many areas around our state that are doing things to help kids, and we really appreciate all of your input. And just knowing that you're there is very comforting, and knowing that we can send families your way too when we get calls from your area. Anyone else have any final thoughts? Well, thank you all so very much for being a part of our webinar today. This slide here just talks about we're doing our Tuesday tips on Tuesdays at 11, and then we have our Thursday webinars like we did today on a variety of topics. And then we do have, you can check on our website for all of our upcoming webinars that we have scheduled through December. And we do have a wonderful COVID-19 website that we try to capture as much information as we can. Rhonda, our director, is wonderful about keeping up with all of the education COVID-19 updates and putting them on our website for families to have easy access to. And then also, if you want to sign up for our e-news, you can go to our website and do that. We usually send it out every other week on a regular basis, and it's pretty much stuff that's going on right now, or information that we feel that's important that families need to know. And this is our contact information. If you want to reach out to us, please do so. There's our web address. And then when you end today, you will be prompted to complete a quick evaluation survey. It won't take you long, but it lets us know how we did and some things we can improve on, and just gives us your input, and we would really appreciate that so very much. Again, I want to thank Shasta and Donald and Davina for joining us today. I think this information was valuable, and thank you, Kelly and Michaela, for monitoring those questions and helping out with that. And we hope everyone has a wonderful day. Thanks again, guys.
Thank you all.
Thank you.
Thank you.